I had a tooth that was loose. And that's when I went to that first doctor. And over time, the other one got loose. And, it just, the first dentist didn't work out, so I came here to Dr. Abraham's. And that's when he told me what we're gonna do is try to save those teeth, do what we can. And if it doesn't, then we're gonna extract them. The one tooth was loose. The other one I didn't feel it wasn't as loose, but it was loose. There was no question it was gonna get worse over time. So the two needed to be extracted. We started with an aggressive cleaning program at first. That saved them for quite a while. But then it got to a point where the best procedure would be to remove them both. Dr. Abrahams fixed those two teeth, put the implants in at half the price that the doctor just up the street wanted. Half the price. Because once again, you got the overhead. There's 4 or 5 dentists in that office. It's all about the money. This is not all about the money. This is about the patient. I needed bone graft done because the gum line was down. So he fixed that first. And then once that was done, then he put a pin in, and then the tooth. And it was relatively easy. It was painless, and I had no problem with it whatsoever, and it was a great decision to have it done. Yeah, the overall health of my mouth now is a lot better than it's ever been. And that's clear. That's clear. Between the cleanings, between the deep cleaning and the implants, Dr. Abrahams has done an excellent job. It feels good, actually, because you're going from a bad situation to a good situation. I'm going from 2 teeth that are loose to 2 teeth that are solid. If you don't get the implants, down the road, you're really going to be you're making a huge mistake. Yeah, you put it off, it could get infected, and then that infection could go to the heart. There's a lot of different things that goes on with bad dental hygiene.